to my next class. So we're going to be looking at carbohydrate metabolism disorders. And we have so many of them. We have diabetes mellitus, we have lactose intolerance, we have fructose malabsorption, we have galactosemia, we have glycogen storage diseases. So the first we're going to be looking at is diabetes mellitus. So let's look at the pathophysiology. Diabetes mellitus is a syndrome with disordered metabolism and inappropriate hyperglycemia due to either a deficiency of insulin secretion or to a combination of insulin resistance and inadequate insulin secretion to compensate. So it's either insulin is not produced at all or that insulin is there, but there's a resistance, the body cannot make use of it. So we have type 1 diabetes, which is due to pancreatic islet B cell destruction, predominantly by an autoimmune process, and these persons are prone to ketoacidosis. While we have the type 2 diabetes, is more prevalent form and results from insulin resistance with a defect in compensatory insulin secretion. Diabetes can lead to serious complications, of course, we know, which result in multiple diseases or disorders that affect multiple systems that may result in premature death. So diabetes mellitus is not a child's play, you know. Now we'll look at the normal pathology of the human body, the way glucose is supposed to be controlled in the body. In people that are healthy, the pancreas, take note, it's an organ that produces the islet cells, which produce insulin. The pancreas, an organ located behind the liver and stomach, secretes digestive enzymes and the hormones insulin and glucagon into the bloodstream to control the amount of glucose in the body. Now, the release of insulin into the blood lowers the level of blood glucose. Of course, you know that. While that of a glucagon does what? Increases, or it allows what? Allowing glucose to enter the body. It increases the amount of glucose in the body. Now, if glucose level gets too low, the pancreas secretes glucagon to stimulate the release of glucose from the liver. Right after a meal, glucose and amino acids are absorbed directly into the bloodstream and blood glucose levels rise sharply. That is right after a meal. The rise in blood glucose level signals important cells in the pancreas called the beta cells, which secrete insulin, which pours into the bloodstream. Within 20 minutes after a meal, insulin rises to its peak. Now, insulin enables glucose to enter cells in the body, particularly muscle and liver cells. Here, insulin and other hormones direct whether glucose will be burnt for energy or stored for future use. When insulin levels are high, the liver stops producing glucose. I hope you are getting me. When insulin level is high, the liver will stop what? The liver stops producing glucose. Okay, let's go ahead. Now, when insulin levels are high, the liver stops producing glucose and stores it in other forms until the body needs it again. As blood glucose levels reach their peak, the pancreas reduces the production of insulin about 2 to 4 hours after a meal. Both blood glucose and insulin are at low levels because at that time when the person eats, the glucose level shoot up and insulin is being produced to help to do what? Bring it down, to make it stable. So about 2 to 4 hours after a meal, both the glucose and insulin, they are at what? Low levels. So look at type 1 diabetes mellitus. Then we'll come back and come and look at type 2 also. We'll just look at them briefly. Type 1, when type 1 diabetes is usually diagnosed in children and young adults. It develops when the body's immune system destroys pancreatic beta cells, the only cells in the body that make the hormone insulin, which regulates blood glucose. Now, only 5% of people with diabetes have this form of disease. It's not that common. To survive, people with type 1 diabetes, they must have insulin delivered by injection or in pump. So most times you see them injecting insulin by themselves. Otherwise, they will not survive. Then the one that is common is the type 2 diabetes. Type 2 diabetes is the most common form of diabetes. The causes of type 2 diabetes are multifactorial. Just follow me. They are multifactorial and include both genetic and environmental elements that affect beta cell function and tissue. Insulin as insulin and tissue insulin sensitivity. In type 2 diabetes, either the body does not produce enough insulin or the cells dey ignore the insulin. The cells are resistant to the insulin. Okay, so let's go ahead. Or that the cells ignore the insulin. It usually begins as insulin resistance, a disorder in which the cells do not use insulin properly. As the need for insulin rises, the pancreas gradually loses its ability to produce it. It cannot produce insulin. Now, when glucose builds up in the blood, instead of going to cells, it can cause far-reaching health implications like heart disease, nerve damage, and kidney damage. Diabetes is the leading cause of kidney failure. Is the leading cause of kidney failure. Non-traumatic lower limb amputations and new cases of blindness among adults in the United States. You can prevent or delay the onset of type 2 diabetes through what? A healthy lifestyle. Through a healthy lifestyle, such as changing your diet, increasing your level of physical activity, maintain a healthy weight. With these positive steps, you can stay healthier longer and reduce your risk of diabetes. So you see that diabetes most time is majorly as apart from the fact that we know that some are genetic, but it's majorly as a result of our lifestyle. Yes, diet contributes a lot to diabetes. So in order for one to be able to reduce the risk of having diabetes mellitus, the person has to be what? Physically active, and make sure you modify your lifestyle. Eat moderately. Whatsoever thing you do, do it moderately, and diabetes will what? Will be far from such a person. So we have done some discussion about type 1 and type 2 diabetes. So we said type 1 diabetes is what? Insufficient insulin. So the body is producing insulin, but the insulin is not enough. Then where we now said the type 2 diabetes is insulin resistance. Insulin is there, but is the body is not recognizing it, is not making use of it. So we'll come back in our next class to discuss about diabetic ketoacidosis, very common with those who have diabetes mellitus. See you in my next class. Bye.